some other disease site, like where the treatment times could be longer, like pediatric patients where it takes about an hour, then the numbers would come down dramatically down. So these are the sort of things I think are very helpful in quantifying the things that we often speculate about. So I do want to make, in conclusion, some of my personal observation, having involved in the planning of the system and then in the first 2 years of the operations of the systems, that proton therapy differs significantly from conventional radiotherapy in its higher sensitivity to various sources of uncertainties. And we need to be cognizant of that fact, that what you see is not what you get, and how you're going to deal with that in your clinic is going to be critically important. And disease site-specific clinical flow must be designed to address the dosimetric effect of these uncertainties, because even if some of the patient have to be treated with modalities other than the proton, even when you have looked at the patient and you evaluated that, you should be able to say no in certain situation, that this is not going to be the ideal situation or ideal treatment for that particular patient. You have to accept that, because that is going to happen once in a while. And workflow modification may be required to increase efforts compared to the other conventional radiotherapy counterparts, but are necessary to optimize proton therapy treatments. And it's highly unlikely that we will realize greater efficiencies in clinical operations of proton therapy system compared to conventional radiation therapy system, with the one proviso that we do in fact can treat patients with lesser number of fields. So there will be some gain in terms of the overall treatment time may be shorter. But in terms of our ability to do high precision radiation therapy, in terms of the imaging that we do in conventional radiation world, that any